Hi, this month's underrated herb is myrrh, and I believe it is truly an underrated herb because the clinical results that myrrh can deliver can be quite extraordinary. So you see there, I've got an illustration with two resins in the wooden bowls. The one up the top, can you guess what one that is? Yes, it's Boswellia. And it's the one down below, you see, which has quite variable coloration and much darker compared to the Boswellia, is the myrrh. And I think it's a key agent against stealth pathogens, any pathogens in general, but particularly pathogens you don't necessarily know about. So as mentioned, it's an oleogum resin, and it comes from various species of the genus Commiphora that grow in Northeast Africa and Arabia. And what happens when the tree gets naturally injured, the resin grows on the wound as a protection, and then people come and harvest that resin from the tree. It's mentioned in the Bible, not just in terms of the three wise men or the Magi, but in writings as old as Psalms. And so it's a medicinal herb that has been valued for its properties for thousands of years. And indeed, the Magi brought the myrrh to the baby Jesus, according to the Bible, in symbolism of its healing properties, in this case, of course, for the wounds. Now, what has really rejuvenated the clinical relevance of myrrh is that there have been several clinical studies, most of them from Egypt, that suggest that a high dose myrrh preparation actually helps get rid of some of the most noxious and stubborn parasites. How's it doing this? Well, we don't know, but I'll be talking about that soon. But the thing that drew my attention for this potential of myrrh was that it appears to be active against parasites that infest much deeper in the body than just, the normal parasite in the gut. So things like the liver and the bladder. And it made me wonder, well, there can't be a direct effect from the myrrh there because these are remote organs from the gut. So a lot of the things we use against worms and parasites are direct acting against them. The parasites in the gut, the herbs in the gut, killing takes place. But how can it eradicate parasites from your liver and the bladder? That to me showed that myrrh had special activity. And what's in it then that is delivering that activity? Well, it's got an essential oil, 2 to 10%, and it's largely these phytochemicals known as sesquiterpenes. But the majority of myrrh is an alcohol-soluble resin, and it contains these resin acids like the commiphoric acids. And I believe that's where the true value lies. We know because of its essential oil that it's antimicrobial. We certainly know it's antiparasitic, but it's also anti-inflammatory and vulnerary, which means wound healing. And I think it's more the resin acids that are doing that than the essential oil. The essential oil is really mainly there for the antimicrobial activity. But cut to the chase, and I'm alluding it to or they're already in the image, which is of the immune cells, that myrrh probably is acting via the immune system to eradicate those parasites from different sites. And if you can eradicate organized and evolved and well-adapted organisms like these parasites that infest the liver, bladder, and so on, if it can help to eradicate them, then it has to be a really significant advance in our capacity to deal with pathogens that are hiding in a person's body and contributing to their chronic disease. So I've already kind of alluded to how it works, but here's some clinical proof. It does, as I mentioned, have the potential to have a direct toxic effect on pathogens, but that's probably not the full story, as I've just said. I think it does work, at least in part, as mentioned, by stimulating our natural resistance and overcoming the defenses of the stealth organism. And as mentioned, the resin is probably more important for this. And as evidence for the way that the resin stirs up the immune system, it can stimulate a marked allergic reaction like contact dermatitis, as you can see in the diagram. And that highlights its stimulation or upregulation of immune responses. So apologies, but it's this slide that has some early proof of that point about Myrrh working by the immune system. So this was a study that was done on the common liver fluke, 35 patients who were suffering from it. There's the little critter there in the diagram. Now, what most parasites do is they secrete various chemicals that suppress the local immune function. And that's how they can live quite happily and avoid any attack from the immune system in various tissues in the body. For example, they're thinking of exploiting that, and there's been quite a bit of research done in using these chemicals that parasites use to suppress the immune system as treatments for autoimmune disease like multiple sclerosis and inflammatory bowel disease. And in many cases, they're actually giving a harmless parasite like a pig parasite, pig tapeworm or something like that can't take hold to get those chemicals rather than isolating them. But that's another story, and your yuck factor is already reaching very high when I'm showing you that image, so we won't go there. But let's take it as read that parasites can depress your immune response, and that was certainly what they were seeing in these people suffering from the liver fluke. Their interleukin-4, as one example of an immune cytokine, was significantly lower than a healthy control group before therapy. But after they were given Myrrh, it increased significantly back to normal levels. So it looks like Myrrh reverses and maybe even goes further in other pathways that we don't yet understand, but at least reverses that effect of the organized parasite in terms of suppressing the local immune function. So what sort of evidence do we have that Myrrh works against these parasites and pathogens? Well, for the liver fluke, there are at least 6 positive trials. There have been mixed trials for schistosomiasis, and that's one that also infests the bladder, as previously mentioned. But there have been at least 2 positive trials. Then individual trials for other flukes, and even the dwarf tapeworm, and even vaginal trichomoniasis, which is another unicellular parasite. And you see there's the trichomoniasis there. And for that, they didn't use the Myrrh as a douche, they gave it orally. There's the references for those studies. So before I move on to how we use Myrrh practically in a clinical situation, I'd like to discuss how I've found this herb in terms of my clinical experience with it. I use it quite a bit now in my stealth pathogen protocol. And indeed, when I realized that many people with autoimmune disease have undetected pathogens that are causing the immune system to malfunction, Myrrh was the very first thing that I tried. And I even had some trial capsules that were made for me that I gave to various patients, and I started seeing excellent results. I have one patient with chronic fatigue syndrome with incredible brain fog, and I put her on Myrrh in the way that I'll show you soon in this slide number 8. I put her on Myrrh, and she reported that her brain, it was like, a veil or the fog completely lifted, and she couldn't believe how miraculous the results were. And I've seen it time and time again. Now, you do need to apply it fairly consistently, and I often use it as part of my stealth pathogen protocol. And that's described in, there's a whole chapter on that in my new book on functional herbal therapy. So the first thing I did when I started using Myrrh was I thought, well, the trials, in the clinical trials, they were giving it for a period of time against the pathogen, the parasite, and then they stop, and then they maybe do it again if needed. So that's a kind of a pulse dosing concept. And I thought, yes, I'll reflect that. Need to take it on an empty stomach, therefore, to 3 to 9 consecutive days. And you can vary that according to what you need. I tend to do it for about 4 or 5 days consecutively with my patients. Then there's a break for 4 to 14 days. I generally break for about a week, and then you can repeat and break and repeat and break and repeat. If it's part of the stealth pathogen protocol, you're going to do that, preferably for 6 cycles. If you're just using the Myrrh on its own, which you can do it for 6 cycles. Now, the daily dose of Myrrh used in the clinical trials corresponds to about 2 to 3 grams of the herb. In other words, 2 to 3 grams of that oleogum resin you saw in the bowl in my first slide. So that's what you need to reflect. So, for example, if I'm using a 1 in 5 tincture, I'll give 5 ml twice a day. It's not that wonderful to use, but in terms of taste, but patients are only taking it, as I said, for 4 days or so, maybe 5, and they don't mind. But otherwise, you can also use a high potency tablet to get that equivalent dose. And if I'm using a high dosage tablet, I tend to go more to the 3 gram herb equivalent rather than the 2 gram. And by the way, if the term herb equivalent or dried herb equivalent means nothing to you, then you do need to buy my book and have a look at in the chapter of the game-changing habits, that chapter there. I think it's chapter 4 or 3, I can't remember. The advantage of the pulse dosing is twofold. It reduces the risk of an allergic response to the Myrrh, as I described earlier, and it doesn't allow the pathogen to adapt to the Myrrh effects. So that's why I advocate it, and it certainly has worked well in the clinic. Now, just another little final clinical anecdote. Myrrh is a wonderful mouthwash, and for gum health, it's probably the best herb you can ever use. So you use the liquid, it's diluted in water. I might mix, for example, Myrrh with, say, sage and calendula, or sage and echinacea, or whatever, and that mix, that equal parts mix, it's diluted 2.5 mils in 25 mil. If you want a stronger effect, 5 mil in 25 mil. I tend to use Myrrh straight as a mouthwash personally, and then it's 2.5 mil in 25 mil. And it just gives you this wonderful clean effect in your mouth, and almost this antiseptic taste, but a benign, not like a chemical antiseptic taste. I feel a very benign, natural one. And I've seen countless cases improve their oral health substantially, help correct gum disease, even help reduce the tendency to tooth decay by using Myrrh diluted with water as described as a mouthwash. So thank you, and I hope I've stimulated your interest in this underrated herb, because it is a special herb and it's been around for a long time and has a wonderful tradition. And now we're adding to our knowledge of this herb by understanding its immune effects.